Antioxidant cocktail improves vascular function in patients with heart failure. This can be one of the quicker segments we utilize. Now, however, this is a press release we're working from, so we're lacking in regard to length of time and other study parameters. The researchers make pretty clear in regard to what is recommended and those dosages per se. Something easy that you could present with your medical professional in regard to treatment paradigms. So with that in mind, let's get right into the research as follows. Now remember, this used to be something called diastolic heart failure that this antioxidant cocktail was utilized with, and of course we'll use the modern name as well, otherwise known as heart failure with preserved ejection fraction, HFpEF. With that in mind, let us begin. A combination of over-the-counter antioxidants shows promise for mitigating some damaging effects of heart failure with preserved ejection fraction. Diastolic heart failure, what is used to be known as, is a chronic condition in which the heart does not fill properly. One of the most common forms of heart failure among the elderly, particularly women. And of course, the research state to date, there have been very few treatments that have been effective in this particular condition itself. So, going right into the meat of the study as presented, in a double-blind study, 16 patients, not a lot, with HFpEF were given a placebo or an antioxidant cocktail consisting of 600 milligrams of alpha-lipoic acid, 1,000 milligrams of vitamin C, and 600 IUs of vitamin E. This was a balanced crossover study, which means that all participants received both treatments sequentially, meaning some took some sometimes, then they took the placebo the other time, and vice versa, thus serving as their own controls. The research team measured various markers of vascular function, inflammation, and oxidative stress. Though the measures of small blood vessel function and oxidative stress did not show changes, the measure of function in large blood vessels and of inflammation improved with treatment. Similarly, presence of biologically available nitric oxide, a compound that helps blood vessels dilate, also increased as well. To conclude with what the researcher statement was as follows. The findings provide new insights into the mechanisms that govern peripheral vascular dysfunction in HFpEF patients, again formerly known as diastolic heart failure. The researchers explained and studies suggest that antioxidant administration may represent a simple and readily available option to improve vascular health in this particular patient group. Again, more detailed information regarding methodology, study length, and so on and so forth is presented. I will link that. Until then, we'll have a link to the press conference itself so you can review the research article on your own. Again, short, sweet, but still vitally important to a large segment of the population out there. I hope you find this information of use. Thank you very much for listening once again, and I look forward to seeing you all once again in 7 days. Again, to repeat, as more detailed information is presented in regard to the study, I will make certain to link it for you. Again, catch you all later on. Thank you very much for listening, and catch you next time. See you then. Bye.